Hello, my students. Our lecture today is a neutral zone technique in complete denture. Introduction. The stability of complete denture is influenced by the surrounding neuromuscular system in the oral cavity. Oral functions such as speech, mastication, swallowing, smiling, and laughing involve the synergistic action of the tongue, lips, cheeks, and floor of the mouth that are very complex and highly individual. Neuromuscular control is the key for the stability of the dentures. Size and position of denture teeth and the contour of the polished surface play a crucial role in denture stability, as they are subjected to the destabilizing forces from the tongue, lips, and cheeks. If they interfere with the function of oral structure. Neutral zone is the potential space between the lips and cheeks on one side and the tongue on the other side. That area or position where the forces between the tongue and cheeks or lips are equal. Neutral zone philosophy. It is based upon the concept that for each individual there is a denture space, which is a specific area where the function of the musculature will not unseat the denture and where the forces generated by the tongue are neutralized by the forces generated by the lip and cheeks. Neutral zone and denture space. In complete edentulous patients, avoid in the oral cavity is called potential denture space. Boundaries of denture space. Superiorly, maxilla and soft palate. Inferiorly, mandible and floor of the mouth. Medially, the tongue. Laterally, the muscles of the cheeks and lips. This is the space as you see in the white color. Neutral zone concept. The central thesis of the neutral zone approach to complete denture is to locate the area in the edentulous mouth where the teeth should be positioned so that the forces exerted by the muscles will tend to stabilize the denture rather than unseat it. The muscles of expression that affect the denture is masseter muscle and buccinator, the cheek and the orbicularis oris, modulus, risorius, mentalis muscles, and the zygomaticus elevator. The muscles of the tongue that affecting the position of the teeth or the denture space is palatoglossus muscle and styloglossus muscle, hyoglossus muscles, and genoglossus muscles. Influence of muscles on dental arch. During childhood, the teeth erupt under the influence of muscular environment created by forces exerted by tongue, cheeks, and lips. Generally, muscular activity and habits which developed during childhood continued throughout the life and after teeth loss. It is important to position artificial teeth in the arch form compatible with these muscular forces. Influence of forces on denture surfaces. The more ridge loss, the less influence of impression surface of the denture on its stability and retention, and the more external surfaces area which is needed to be contoured properly to overcome this situation. The forces on external surfaces are changed in the magnitude and direction during function and remain constant at the rest. In order to construct denture that function properly, we must develop fit and contour of external surfaces as fit and contour of impression and occlusal surfaces. Objectives of a neutral zone techniques: rehabilitation of complete denture patient, achieve maximum prosthesis stability, comfort, and function, arrange the denture teeth and contour the complete denture polished surface, minimize the ongoing diminution of residual alveolar ridge. Indications of neutral zone techniques: severely atrophic mandibular ridge, high mentalis attachment, neuromuscular disease, atypical shape of oral structure, trauma, systemic disease, locate optimal position for implants, partial glossectomy, motor nerve damage to the tongue. Recording neutral zone in the final impression stage: primary impression of upper and lower arch, construction of acrylic bases. Impression compound is adapted on external surface of the special tray and inserted into the patient's mouth. Establishment of occlusal plane, locating neutral zone for the upper arch, vertical dimension establishment. Lower final impression with zinc oxide. The lower record base is inserted with the lubricant upper denture base together to make an impression with the closed mouth technique. Second impression is made with the Carex material, which is white, soft, thin, free flowing, and contrasting color with the zinc oxide eugenol impression material. Making of upper arch impression: several holes is made in the rugy area to allow excess of zinc oxide eugenol material to escape during impression, as we see in this picture. This is the holes. Second impression with Carex, centric relation record, mounting to the articulator and fabrication of the matrices. This is the matrices, or what is known as matrices for the external surfaces or polished surfaces. The arrangement of teeth, this is this area, arrangement of teeth. This is the lingual matrix, this is the buccal and labial matrix. This is the space, the teeth will be at this space. This is the denture space after taking the neutral zone. The denture and neutral zone impression for polished surface, and the denture is ready for the investing. This denture is ready for investing. Recording neutral zone and jaw relation visit. After making primary impression with impression compound and final impression with the zinc oxide eugenol impression material, jaw relation records. Lower acrylic special tray with metal spurs, as we see. This is the metal spurs in the lower special tray, and occlusal paras built in a green stick, as we see here in this picture, to establish the occlusal height. Instruct the patient to perform certain oral movements, including sucking, grinding, whistling, bursting of the lip, and swallowing. Tissue conditioner being molded with the mouth movement, as we see in this picture. After using the tissue conditioner and ask the patient to make the functional movement, the result it will be as we see in this picture. This is the lower special tray, and this is the green pilar. The tray is returned to the cast, and the plaster index is performed. This is the plaster index or matrices. This is for the maxilla, and this is for the mandible, and the teeth. Wax removal formed for setup, for teeth setup, and then insertion inside patient mouth for the trying. Recording neutral zone in trying stage. Apply Vaseline on the trial denture before making impression. Impression material is applied on buccal and lingual surfaces of the waxed up denture. Patient performed oral function. Inspect the impression on polished area including palatal surface. This is the result as we see in these pictures. Carefully curve the impression material from the teeth surfaces with carver, then finishing the denture after making the index for the neutral zone. Recording neutral zone in finished denture. Coat the polished surface of the denture with low viscosity silicone impression material. Ask the patient to perform functional movement while material set. Inspect the denture and adjust any heavy muscle contact. This is material, and this area there is no impression material, so that means there is a heavy muscle contact, so should be adjust relief, making relief for this area of the denture. Remove the teeth and base material from the segments of the denture that needs modification. Apply adhesive and make the impression with moldable material. Check for stability and undertake the laboratory procedure. Comparison between conventional mandibular denture and mandibular denture made by neutral zone concept. According to the setting of the teeth in relation to the crest, anteriorly in the conventional denture slightly labial, while in the neutral zone slightly lingual. Premolar area in the conventional method exactly on the crest of the ridge, while in the neutral zone method slightly lingual. But in the posterior teeth, in the conventional method, the posterior teeth will be sit lingually, while in the neutral zone method will be seated buccally. According to the denture surface area, the neutral zone denture tissue surface area is higher than the conventional denture. According to the denture volume, the neutral zone denture volume is lower than the volume of the conventional denture. Advantage: improve stability and retention, correct positioning of posterior teeth allowing sufficient tongue space, reduce food trapping adjacent to the molar teeth, good aesthetic due to facial support. Limitation for the success of neutral zone impression technique: Viscosity of material used, more viscous, that mean more difficult for the muscle to mold. Geriatric patients could suffer from the procedure due to loss of their muscle tone. Proper stability and retention of the bases so as the comfort. The resultant ventral zone is often narrow and might be lingually placed. This will affect functional movement of the tongue and phonetics. The technique does not offer any guideline for the selection of teeth. Thank you for your listening.